There we go. All right. So welcome back. Oh my gosh, can you believe this is like our 5th week of getting together and just talking about what's on our mind these days with all of the craziness that's going on. Everybody has been heavy on my mind because I am seeing more and more about nursing homes, and COVID has made it there. And I'm just really scared for all of you and just really thinking about all of you and praying for all of you and hoping that you are doing as well as can be expected, maybe even a little better than can be expected. But you are heavy on my mind, I know for sure. Oh my gosh, Heidi Peterson, how are you? I haven't seen you in forever. Oh my gosh, I love all these names that pop up. This is awesome. All right, so what we're going to talk about today is really kind of up to all of you because you are the experts and this is your time, and I'm just kind of here to facilitate the conversation. But I did have a call or a question to put out there. Does somebody want to say something? Okay, I did have a topic to put out there just to kind of get the conversation started. And it's what's one thing that you've learned from prior calls that you've changed or tried or put into place. And so I was just kind of curious as to if anybody has anything they'd like to share.
Well, we here at the Oaks at Hampton, we are, the idea of a care partner sanctuary just really resonated with us. We had already started our plans to change our break room into the sanctuary. And then we realized that with the beautiful weather that we have up here in the North Georgia mountains, most of the time, that why would we want to turn an interior room without a window into a sanctuary? So we decided to do it outdoors. It's not in place yet because we've ordered a really, really nice gazebo, and we're going to have it set up with nice, comfortable lawn chairs, obviously spaced appropriately, and have some music out there for them. We're just coming up with all sorts of ideas. And of course, we were already working diligently our care partners are so important. They're the frontline folks. We're blessed with the Oaks because our company, our owners, were family owned. Our owners have given up their salaries for this period in order to see that all of our care partners and housekeepers receive a hazard bonus for the duration of this time. So they're actually getting an extra $2 an hour in addition to their regular pay, which means a lot. But we are loving on our care partners any way we can, without hugging them, of course, because it is difficult. And even though this is a very, very hard time for all of us, I have found, and we talked a little bit about this on the call before last, I believe, how the dynamic has changed. Our relationships, even though it's a difficult time, we've all become closer with each other, with our staff, with our care partners, our residents, all of us. There's a lot of good, a lot of silver linings that are going to come from this.
Mm-hmm. Nice. Gail, I have your Facebook page up. Do you want to kind of talk about what I'm going to share here?
Sure. You bet. I wish Sachi was in here. They're showing the door. That's one of our residents there. Our lifestyle director in Horizon, Sachi Wilson, she and Sandy DeKroger, who's with me now, she's the lifestyle director in assisted living. They've been doing an awesome job. What you're seeing now, was a project that Sachi came up with last week. The residents in our memory care neighborhood, Horizons, that's Shirley right there, the residents, the care partners, the managers, I'm in there too. This was our project. It's a faux stained glass door to symbolize, number one, that we're in this together, and number two, our faith and our hope during this Holy Week. We know that we'll get through this with God's help, especially as we lean on each other. And that is what this symbolized. It was so meaningful. Our residents in Horizons, they knew exactly what we were doing, what they were doing. We talked about it. They spoke about it. They spoke about what their faith means to them and what this project meant to them. So today, we are really enjoying this, and of course we'll leave it up until after Easter. That's Sachi right there. That's our lifestyle director, Sachi Wilson in Horizons, who came up with the idea. And it was just so meaningful. And we had people that it brought tears to their eyes, residents, as well as lots of smiles. Some of the residents started singing old hymns that they remembered. as we were painting it and afterwards. It was just very special, a very special project.
Wow, very cool.
And I'm not an artist. I think that my piece of it is probably the worst.
Can I interrupt? This is Anna from Oregon. I want to say thank you for being the kind of organization that makes this kind of sharing something that your care providers really are happy and empowered to bring out and share with everybody. It sounds, not 10 years ago, that might not have been possible. So thank you for being who you are and being part of this pathway of even care.
Thank you. Thank you, Anna.
Okay.
Very cool. Thank you, guys. I'm so glad that you shared that with us. So thank you. I'm looking to see. Love this idea. We'll pass it along. It's beautiful. I'm sure it's even more so when the sun shines through it. And Gail, you said that the neighbors even noticed, right?
Oh, yes, absolutely. Yes. And we all, of course, we've had neighbors from the subdivision come over and paint our doors in assisted living from the outside as well. So all of our doors just about are painted. But that one particularly is meaningful because it was painted by all of us together with the residents.
Yeah. Love this idea. Yeah, Oak Senior Living rocks. Gail, you're such an incredible leader. What a great idea. It's beautiful. It's beautiful. So yay, everybody likes it. So thank you for sharing that. Anything else you guys want to share?
Well, as far as, us, Sandy, did you want to say something?
Well, we actually had an Easter egg hunt this morning, and you can still do it. We have a beautiful backyard and a patio, and we hid the eggs out there and let the residents 5 at a time go out and find Easter eggs. And then those 5 came in and 5 more went out. We had that this morning, and then this afternoon we're having a rubber duck race. We have a beautiful fountain in our front area, and all the residents picked a duck and wrote their name on the back. And they're all gonna be dumped in the fountain at 1 o'clock. And whichever duck gets to the finish line first, we've got a big Easter basket for them.
Oh my gosh.
They've been talking about it since last Wednesday. When can I get my...
Can I get my duck? Can I get my duck?
It's the little things.
It is the little things. So thank you, guys. I love it. I love it. I love it. All right. I'm looking. Meredith, thank you for reposting the question. Other ideas that you've taken out into the world that you've gleaned from these Friday gatherings. We'd love to hear from you. Anybody, you're welcome to unmute and share your idea, or let me know you're okay. Jenny's raising her hand.
Hey guys. Yeah, my focus, I guess, really shifted after last week, and I think not necessarily because of the call, but just things that were happening within our community. And so I just wanted to share, I guess, some things that we're doing for staff and kind of ways that we're restructuring things for our elders. I work in purely memory care, and about a third to a half of my elders are at the very end of their journey, and they're who I'm most concerned about. And so we went into full quarantine. We don't have the virus yet, but we're trying to keep everyone in their rooms, which, as you know, in memory care is like pushing a rope. That's what my grandpa would say. And so we've shifted to trying to give a voice to the elders that are most frail and easiest to isolate, right? If you can't ambulate or self-propel any longer, you're who I'm most concerned about. And so we've taken to, having meals outside because it's right for the elder and right for the care partner. And just really restructuring our day. So I hate to say that we're pushing aside those who are more independent, but that's what we've chosen to do with our resources, is give them some more independent things to do and really focus on the most frail. And then for staff, so I decided to go into work last Sunday. They were on my heart, and I found in my office/junk closet a box of window markers. And so we took to the parking lot and just wrote on their cars. It was really simple. Wrote like healthcare heroes and angels and scrubs and honk for this person. And oh my gosh, they were begging me. The second shift wouldn't leave until I had done their cars. So that was just such a simple sweet thing, and they were so proud to drive around like that. And then just yesterday, I sent out a text to all of our family members, just asking them to put together a quick, less than 30-second video of them thanking the staff. And so those have come pouring in, and we're just going to stitch them together and surprise the staff with just a video of all of them giving their thanks, which I think does a couple of things. Like, one, it's to celebrate them, but also to remember whose loved one we're caring for, and what an honor that is. And I think, sometimes this is weird and crazy, and, we're humans caring for humans, and we screw it up a lot. And so I just wanted that reminder of whose loved one you're caring for when you choose not to cut corners, or you choose to give the best care possible. So those are just some of our ideas from Chelsea Place.
Nice. Thank you, Jenny. And you're getting lots of affirmations. Totally cool. Love the spontaneity. Love the, you said they were like markers, right? Not sidewalk chalk, but like markers, right?
Yeah, there's something I'd ordered off Amazon. They're amazing. They work on all the windows. So I've also used them. We celebrated a 93rd birthday and an 88th birthday this week. So we used them to decorate the windows. And then when the family showed up with their posters and signs, everything was like decorated like a frame, and it was all very cute. But it's amazing what $20 worth of markers has done for morale, honestly.
Wow. Wow. People are like loving it. Love the focus on the team. They are heroes. Words of affirmation. Bless the giver and the receiver. Tears to my eyes. Thank you. Brilliant. Oh my gosh. Yeah. Beautiful. Beautiful. Jenny, you always have great ideas. Thank you, and all of your team, for all you're doing to care for each other. Very cool. All right. I love that. Who's got something else to share? What ideas have you been gleaning? I have to tell you, one of the things that really stuck with me was, I think it was last week we were talking, and somebody had put in the chat box about the idea that that elders have passed that have gotten COVID in their communities, and how much guilt their employee care partners are carrying, because what if I was the one that infected them? And I can't even imagine that burden. And so I've been doing a lot of thinking about that and praying about that. It's like, I don't know how you wouldn't even know. And it would just be it'd be a really heavy burden to bear. Evie?
So since you brought that up, I was going to wait till the end. One of our own Eden educators actually has COVID, Ryan Bermud from Denver. Oh. And he wrote about it on Facebook, so I feel free to bring it up, about what his experience is. And going to his Facebook site, it's unbelievable what people go through. And then it looked like he was getting better, and then he took a turn for the worse, and then he ended up in the hospital. But he did come home yesterday, and he's on oxygen. And I think that's the other side of it. Here's somebody who is an administrator who got it. And I'm sure he's worried about how many people he has infected, and just all the dynamics around it. So I'm actually going to ask you all to put prayers in for Ryan. He's an amazing human being, and I hate to see anybody going through this.
Yeah. So. All right, Joan says, something to share related to caregiver support, a new resource by the Java group programs. Java is awesome. So if you haven't ever heard of Java music group, go out and search them up. They're very cool. I did a Java music group when I was in Sherbrooke. It was a lot of fun. It's a video with 5 practical activities to help reduce stress, which is very nice. I love that. They interviewed somebody yesterday on the news that teaches a course at Yale on happiness. And she blogs and does little tidbit things that you could pull up and do. And I cannot tell you, if you know her name, put it in the box. Because she was just brilliant. And the 5 things you need to do to have happiness in your life. And it was all about eating and sleeping and deep breathing and stuff. It was very simple. Yeah, thank you. Lori Santos. Yeah. Yeah, so Google her. I think she's got some good stuff. Brian's last name is Bermud, B-U-R-M-O-O-D, right, Evie? Okay. Yeah. Anybody else? Anything you'd like to share? Something you've taken away from our time together? Okay, being quiet today. Quiet and thoughtful. So, okay, so here's another question. So what have you seen in terms of support systems happening between the elders? Do you see any ways that the elders are kind of uplifting and holding each other up during this time? New ways that might not have happened otherwise? Yeah, elder to elder connections. Yeah, what are you seeing?
Denise, while people are thinking, um, I would just add that returning as we always do to our core beliefs in this work that we do. You know, the elders are an important part of the solution. And a lot of what you see, if you read a lot of, you know, the stuff that's floating through, a lot of it's talking about, you know, the elders as frail, helpless, you know, isolated, et cetera, et cetera. Some elements of the epidemic actually magnify the inherent ageism and the idea that, you know, that the elders are poor victims in all this. So whenever and wherever we're able to position elders or position ourselves alongside them as part of the solution, we're actually undercutting a lot of that messaging and really transmitting this idea that they are an important part of the solution.
Nice, nice. I had one team, I mean, we're not having too many registry calls right now because obviously there's way more important things going on than talking to Chris and I. But I did talk with the team that actually gathered and informed the elders, you know, how much they were trying to keep their home clean so that we weren't passing germs between one another. And a couple of the elders said, how can I help? So they equipped them with rags and cleaning solution, and they're helping to, you know, clean up the rails and clean up the tables. And, you know, they can be a part of the solution, still physically distanced, but feel like they're doing something to help their immediate community be better and stronger.
Yeah, and just to add on to that, Denise, actually what, and part of that conversation, because I was there for that, is they had found out that a few of the people, a couple of the ladies had already been cleaning little areas around where they lived in independent living. So they were already doing it and they didn't know it. The staff didn't know it. So they were trying to go back and do it again. So then they were like, hey, let's come out and clean more areas for people. So it was really kind of cool where they found out that the elders were already taking action and doing some things. I think it was our happy hour call on Wednesday, our social happy hour, where it was brought up that, you know, I think it was Jack who said youngsters, you know, the youngsters are kind of having a harder time with this actually than some of our elders because they've lived through so much. So one of the employee care partners was kind of freaking out, and she went to her teachers, or the elders, you know, that she worked with, and they kind of said, honey, everything's going to be okay. You know, there's been all this stuff that has gone on in my life, and look, I'm okay. You're going to be all right. And the elder was actually very reassuring to that care partner. And she said, I just felt so much better after talking with this person and hearing their life experiences. So lots of richness there as well.
Nice, nice. So Ryan, Myra, Cole, I want to hear from you.
All right, so at Signature, we just started a Pen Friends program. So it's a pen pal program called Pen Friends, Write with Purpose, because, you know, we're all about everything with purpose. So we've started that, and we're reaching out to the various Signature communities to see which elders want to be involved with this, and then we're matching them with each other. So, you know, we've got 115 or so locations. So this really gives us a chance to connect with elders throughout the organization, but then we broadened it to reach out to community members, because we do have a lot of homes in rural areas that have support from churches and other organizations. So this gives them a reach to the community as well, or the community back to the elders. So just kind of a cool idea that some of my colleagues came up with, and we're pushing that out.
Nice, nice. Very cool. You're getting some accolades on the chat box, so be sure and check that out. I love it. I love it. I love it. Carmen says, yes, elders can help meaning and purpose. Yay. I love this. I'm looking to see. So Evie, you made kind of an interesting comment. You want to kind of give us some background as to where that came from and what's going on?
Well, I don't want to, again, I was going to leave it till the end but I put it on the chat box. So on our DAA call yesterday, Dementia Action Alliance, I'm on the Optimizing Wellbeing group that meets monthly. And someone had brought up that AMDA is promoting the use of Haldol to prevent wandering. Has anyone heard about this? And if this is true, as an organization, could we respond?
I would like to make sure that that's accurate before we don't know, right? We don't know.
No, we want to make sure it's accurate. But I mean, the person who mentioned it at the DAA call, I mean, kind of, the people on that committee are pretty attuned to what's going on.
Yeah, that would be sad. I hope it's not true. Okay, so David Green, you had something in the chat box. I want to hear from you. How are you? You need to unmute. So go down into there you are.
Good. I was able to listen to the call last Friday, and one of the takeaways, our residents or elders are having to stay in their rooms a lot more. They're not able to move around the home as much. And so I wanted to make sure in all of this that they were getting the voice that we talked about last week. So I got with our activities director, and her staff is going to do some interviews, individual interviews with elders. We're going to take their thoughts on these things, bits of wisdom, their questions they might have, and put it together in a newsletter that we already do for them. And it's really their newsletter. They do the writings in it and publishing it, so that we can make sure we're answering their questions and giving them all a voice. And then we're going to publish that for them to do. We wanted to do it in a fun way, so there's puzzles and different things like that already in that newsletter. So we'll keep that going, just to present it to them in more of a positive way.
Nice. Very cool. The written word, yeah. Who doesn't like that? Yeah.
I want to raise that Haldol issue. So I just did a quick look at what's published related to AMDA and related to Haldol right now. I'm not seeing that it's bubbled up to that level, so it's good news. Also, there was a very significant study that just came out a couple of weeks ago demonstrating increased mortality with Haldol use. And we need to keep an eye out. If that's sort of bubbling up, we need to act, because I think Evie's kind of fired up the flare gun, but I'm not seeing it as any kind of official communication right now. And certainly the evidence is strongly opposed. So that's all I wanted to say.
Thank you. And Ryan, you added something else. We also have leadership volunteering to handwrite thank you notes to every care partner working in the homes. It's been amazing. Wow. Very beautiful. All right, anybody else? The floor is yours. You are the experts. You know what's going on. We want to hear from you. Or if you've got questions for the group. Anybody have something you want to share?
Well, I'll have something, if I could, that I would like to share. Is that all right with everybody?
Absolutely.
I just wanted to reflect a little bit about, what's happening right now and what lies ahead. I did an interview with a media outlet yesterday, and the people who were interviewing me kind of brought up the topic of workforce and how big an issue workforce has been for all of us on this call. And I was making the point that in a time like this one, there are a lot of people who are really our heroes, as we heard discussed. We're writing on their car windows because they're doing amazing stuff. And also, this is a time, we haven't thought about it a lot yet, but it's going to be a time of great economic dislocation. And I just want to say to everyone out there, and I know you're all in different positions of responsibility, because of the terrible economic toll that this epidemic is wreaking on us, there are going to be literally millions of people searching for good work that feeds the heart and soul, work that is essential to the well-being of the people around them, and who are not going to be able to simply return to the job they had before. And I would just like to put out the welcome mat and say that we are about to be joined by some really amazing, talented people who never gave us a look before.
Mm-hmm.
So let us all, kind of comb our hair, trim our beard, put out the welcome mat and say, working with us is really kind of great. And I think we're going to be able to recruit people into the field that wouldn't have come to see us otherwise. So I just wonder, and Denise, this isn't exactly on track with what you were asking, but I'm just wondering if anybody out there who's got a responsibility for bringing people in and getting them started, has anyone had any experience yet with somebody new coming into the field as a result of the epidemic?
I didn't have
Kaylee,
this.
I have Kaylee's hand up. Let me get Kaylee and then I'll come to you, Tina. Your hand's up, Kaylee, but we can't hear you yet.
Y'all hear me right now?
Yes.
Okay. So I'm the director of Harvest Home Care in Missoula and Kaven's sister. And we recently put an ad out to invite our laid off community members to consider joining us to support our elders and the hard work we're doing. And immediately, we're kind of inundated with service workers from the industry here in our local town with applicants. We hired 5 off the bat that were just incredible souls that had their own stories caring for their grandparents and their neighbors and their friends. It was just exciting, and they had no idea we existed or really didn't consider, this line of work until now. So we definitely tapped into that idea that Dr. Bill is talking about, and it was just exciting. And when we're hiring them temporarily, but in our discussions as we're getting to know each other, it just organically turned into, even when your job might come back, you should just stay on board and at any level that you can. And so it just developed into something really special. And Bill's right on. This is going to open up, what we do to the world in a deeper way, and we're just really excited about it.
Yay!
Can't wait to see more work for them.
Thanks for sharing that, Kaylee. Good job.
Very cool. Nice to meet you, Kelsey. We hear about you all the time from Kaven, so I'm glad I get to meet you finally.
Aw, geez.
He talks very highly of you. Very cool. Very cool. Tina.
Yeah, I think especially now we've had some that have started, and it's been really positive. I think also just what we've seen is how that it's important to nurture those staff and to help them feel, I think some of the things that have, this kind of ties into the original question of like, what have you drawn from these calls, and to come alongside staff and to say, you are cared for during this time and you are supported and we're walking with you, because it is really draining work right now. And especially if they're working directly with people who do have positive cases of COVID. I think it's a lot, and they're saying, I don't know, I think it is really draining. So to say like, we want to walk with you and we want to journey with you and help lift you up emotionally and spiritually, and nourish you, like give you food, like nourishment of mind, body, and soul, and to just help these employees know that they're not just employees, they are truly care partners. And so I think that that's really important. And I there's this piece of this that I think I have like kind of debated whether to mention or not, but also I think with new care partners coming in, a lot of them haven't, some people have dealt with loss, and others are coming from total different industries or different areas and haven't dealt with that loss. And it is hard. It's really hard. And we have just experienced our first loss as a result of someone with COVID, and it is really sad. And it's sad anytime somebody passes away, but I think for our care partners to come into this, we really have to have those conversations to say, like, what do you need? And to really have conversations with everybody in the community as they join about what loss looks like in the community. So
Thank you.
I don't know, yeah.
Yeah, yeah. Oh my gosh. So I see Therese Malpin-Moore put in here, we just filled our CNA class and it starts on Monday. Holy cow, that's awesome. I don't know if you want to say any more, Therese.
Yeah, we actually filled it, and we're actually almost got the next one filled as well. So we're excited. But we're also stuck at home, not able to go anywhere. So people are wanting to get out, I think.
Yep. Yep. Very cool. Very cool. So congratulations. That's very good. I saw somebody else said that they put out feelers that they needed some people to work overnight, and they had amazing responses that they weren't expecting. Yep. Linda Bennett says we've had some overnight folks that we weren't expecting. Yep. Oh, Tony Conchito's on. Hey, Tony, go ahead. You got the floor. Make sure you unmute. I'm looking for your face. Are you still with us, Tony? There you are.
Hey, while we're waiting for Tony, can I just put in a little comment? I put this in the chat box that we're going to do a Facebook Live show with Tony coming up on April 27th to talk about, so Tony does, and hopefully he'll pop in here in a minute, but they're working with organizations all over the country doing recruiting right now, and he's got a lot of great things to share on that. So it's our every Monday we're doing Facebook shows. And Denise, maybe at the end you can let me talk a little bit about our upcoming guest next.
Yeah. So Tony, I can see that you are connected on audio and you are unmuted. So let's see if we can hear you. Nope. So what I would do, Tony, go to the little up arrow by your microphone down in the lower left-hand corner or wherever your little microphone is, and make sure you're connected to the right microphone, because that's been one of my challenges, is that I'm not connected to the right microphone. Just make sure that's right. If not, the other option is you can choose to call in by phone and switch to phone audio, and just let me know when you're reconnected. I'm not hearing you yet, Tony. Okay. Ah, Jack, I see you. Hi.
Hi.
Jack.
Hello.
Yeah.
I apologize for being late.
You're good.
No, I was on another call, which was actually very interesting. I don't know whether you're familiar with the Empower group, but they're trying to figure out how to mentor people to advance within senior living, and particularly with an emphasis on identifying the talent that women bring to the industry. And that discussion was so fascinating. I was just eavesdropping, because although the conversation was about advancing women and all, I was thinking, well, the neglected resource of the whole industry are in the residents, and we're the group most discriminated. But I chose to stay mute. I spared them that. But it did get my intellectual juices flowing, and I know this group would be very sympathetic toward that point of view. They were talking about finding mentors. My goodness, there are many, many mentors among the more cognitively still functioning group of residents, and some of whom may be physically frail, but can still be great mentors.
Oh, absolutely. Absolutely. Thank you for that.
Denise, are you okay if I say something? It's Olivia.
Yes. Hi, Olivia.
Hi. So I really wanted to comment, and I saw Evie Kugelman's statement too, that she asked if people were scared of coming into long-term care, because of the number of deaths that have been reported, or just the news media has stated, or they've seen in the papers. So we actually got a lot of individuals from the food service industry that we've really been needing in our food and nutrition departments. And I will tell you, the level of customer service and their different approach, even delivering room trays, the residents have loved. They have thought it was so much fun. We have somebody who was displaced by Starbucks, which blew my mind. I will tell you, I've gotten a call from this resident that I used to get to work with when I was at Amberwood, and she's getting latte art, like lattes delivered to her room. And she thinks it is the best thing ever. And this woman has never, she just never had that. Like, I would ask her to go to Starbucks or somewhere with me, and she's like, no, I don't need that fancy stuff. I just want a black cup of coffee. And now, like, little pictures that the activity director is sending me of latte art. And this care partner has told us she knows that she wants to go back to Starbucks because just some of the benefits are so good, but she wants to still do things in long-term care. And I was just so excited, and the joy it brought. And now she's doing latte orders, she's delivering them, and just she's creating new art. And I just thought, we have so much to offer, I feel like, other industries, but what they bring to us and the joy that they bring, and I was just so excited to hear it. And I was just tickled, and I just wait for my next photo. I just wait for my next photo of latte art. And I think it gives us the chance to see, like Dr. Bill Thomas said about just they're talented, not only talented. And this woman, she wasn't quite scared. So many of the communities have outbreaks, and she just said she's just thankful for a job, and she's ready to serve. And then the people that are positive, she's going in with her PPE, and she's giving them their lattes. She just goes, and that, I think, is so special. So I've really been excited to see how we can impact them, but how they're already impacting us.
Nice. Thank you. So Tony, let's see if we can hear you now.
How about now?
Perfect.
All right. Sorry about that. No, I just wanted to chime in on this, because obviously this is a big topic, and thank you, Dr. Thomas, for bringing this up. And this is a wonderful opportunity for really quality, mission-driven elder care organizations to shine. I mean, we, through adversity, it shows our true character. So people need to know about us. And so we're a proud value-added partner of the Eden Alternative, and we work with a lot of different elder care organizations around the country. And we're finding, there's again, it was mentioned earlier about people, do they know that it's safe to work at the communities? And it certainly is. It's very regulated, and I don't have to explain to you, because And so sometimes I'll ask people, who recruits for the organization? And a lot of people say HR or the recruiter, and the answer is everybody. Everybody needs to be an advocate for the organization. So anything you do in the community, whether it's a friend, family, friend of a friend, somebody who's great, giving you great service, you really have to spread the word about why, working with elders is, it really does feed the heart and the soul, right? And people don't know what they don't know. And so all these people, these millions of people are going to be out of work, and who are out of work, they may do it first for a paycheck, but who knows? After a week, they'd be like, you know what? This feels pretty good. And next thing you know, you got them hooked. So it's almost like, tell them first and get them curious. And then I think that the message has to be conveyed of why coming here is going to be something that you should be at least explore. Don't oversell them. Just get them to be curious. And so there's a lot of messaging via all the different mediums, whether it's online, social media, or word of mouth. But I think you need to articulate that and communicate that with your current staff to get them thinking, because they're the ones going to be saying, I need help. Well, you're either going to complain or you're going to be part of the solution. And so part of the solution is doing something, and doing something is really advocating so you want to expand your circles of influence. Everybody has their own circles, and as they communicate to others, other circles of influence start to be created, and et cetera. So there's a lot to this, right? And this is something that keeps us busy, and we're seeing, we're finding the highest quality providers out there are really shining, and the ones that aren't, not so much. And so this is a really good opportunity for us to look at ourselves in the mirror of who we are and what we represent. So again, I can go on and on. I know I'll be talking in later in the month, but it's just a topic that's going to become more and more in the forefront. And it always has been, but now it certainly is showcasing even brighter at this point.
Absolutely, absolutely. What did I hear? 17 million people looking for work, and they got to be some really good gems in that. Some
That's
really
right.
good ones.
That's right.
Absolutely. Thank you, Tony. I'm glad we got you on audio. Yay.
Thank you. Sorry about that.
No, that's okay. That's okay. All right, everybody's saying thanks for sharing. I love that. Chris, I don't know, you made a comment about the service, because I know you've been in the restaurant and service field for a long time. Is there anything you want to add to your comment?
Well, I just, at my first job, on my first day in assisted and independent living in the dining department, and I was a supervisor, and I was told right away to stop working so hard by my supervisor. Stop, you got to stop. You got to stop working so hard. I'm like, okay, never once in my life in the dining industry, I worked front of the house, back of the house, have I ever been told to stop working hard, right? It's usually the other way around. And they said, no, you're going to make us all look bad. You need to stop. And then I remember about a couple months later, a server in the dining room, in front of everybody, the elder said, I only ordered a half a baked potato. I didn't want the whole baked potato. So she picked up the potato off the person's plate. Now, it was wrapped in tin foil, but she ripped it in half, put half back down on the plate, and put half back down on her tray. And I said, you need to leave and go home right now. So, and my bosses were like, what? And I said, if it's okay for someone to pick up a baked potato and rip it in half in the middle of the dining room and put the half back down on somebody's plate, I am working in the wrong place. You have such low standards. If you don't see anything wrong with that. So that's kind of where I started with this. And I'm always amazed of why people, this is independent living. This was in an independent living dining room. So I have just been amazed from the beginning of why this seems to be different for some reason. To me, it's not. These are people. People are people. So it's been a ride, I'll tell you that.
Yeah.
Can I have a word? Thank you. Can I have a word about that?
Please.
No. So, Chris, I want to build on what I'm hearing from you, which is that every corner of the world has its way of doing things. So, the dining industry, food service industry, healthcare, anybody on this call who's ever scrubbed into an operating room, that they have their way of doing, everybody's got their way of doing things, okay? And all of us on this call, we all know how gosh darn hard it is to change people's way of doing things. In fact, I would describe the Eden Alternative as a strategy for helping people change how we do stuff. That's what we do. We help people change how they do stuff. And we work really hard at it. And I actually think we're pretty darn good at it. The terrible stress and fracture and dislocation and grief, and I'm reading in the chat box there, grief that is incumbent upon us is actually one of the things that will give people permission to change how we do stuff. And I want to challenge everyone on the call. Given the terrible suffering and the terrible dislocation and trauma, we must not let this moment go by without asking a lot of really hard questions about why we do stuff this way. I mean, there's a temptation, and I hear it a lot in other places where I'm working, of can't wait to get back to the way it used to be. Yeah. When this is over, we're just going to go back to how it was. And I'm saying, no. In the future, the elders' voices need to be louder, and we need to hear them better. In the future, the elders need to be part of the solution. In the future, we need to say, we can raise our standards. We can do that. So I'm sorry if I'm going on at length here, but I just want to say to everybody, I'd like to give a challenge, if I may, Denise, to this group. We're going to get together again in a week. And what I want to hear next week, I am telling you, is how you challenge the status quo and what's going to be different after because of this calamity and all of the suffering and all of the trauma. We better execute, and we better raise our game, and we better seize the opportunity to change things. And if we don't, we have something to answer for. So apologies for speaking at length, but Chris, you really kind of set me off there. And Denise, thank you for letting me jump in.
I appreciate it. Jack, you've got you ready. Go.
Yeah, I'm ready because I really want to support what Bill just said. I think the effect of this crisis is not going to be to change the trends that have been coming, because these trends have been underway for the last 20 years, and with people pushing back. What it's going to do is accelerate the change. And if I can take 1 second, there's a conference coming up that Bill Thomas is featured in. And I don't know whether everybody knows about it. It's quite a bargain. It only costs, I can't do screen sharing. I was going to share, there's this virtual summit coming up in April. And just this morning, Steve Moran released the whole picture with the speakers and the agenda. I was going to share that, but I think that's a real opportunity. Number one, it's changing the way the industry meets. Typical is Leading Age gets together with 8,000 people in a room for a top-down presentation of how wonderful all the suppliers are who make their living providing beds and things to the senior living industry. Now, with this explosion of virtual usage, we can go beyond that. And I don't know, Bill, do you have that agenda for the conference coming up? Because we've got Ken Dykewald, Bob Kramer, just leading lights of this industry day after day after day. For $47, you can buy into this whole package of a conference. It's going to be available. And it's just a tremendous opportunity. Moreover, if you're in a nursing home administrator, for $100 more, you get CEs, 30 hours of CEs for $100. That's a hell of a bargain.
Thank you. Thank you. I think we have heard of it. I don't know the name of the organization really well, but we have heard about it, and we hope that they have a great conference. That'll be awesome. And Meredith is going to put the link in the chat box. So be looking in the chat box and you'll get a link to it. I apologize. I couldn't bring that fast enough to figure it out. So thank you for that. Thank you.
I may have a later link that'll be better. So I'll put that up in chat too.
Okay. Thank you. Thank you. Yeah, I think getting the like minds together is, I don't know, it's been really moving for me these last few weeks. So I'm enjoying it. Okay. So, Bill, thank you for bringing up and I love the whole workforce thing, because that's kind of what I'm thinking. I'm thinking, like, this is our opportunity to show how awesomely awesome we are caring for elders, and we need more nurses, and we need more people willing to get into this field of greatness. And this is our chance to shine, for all of you to shine. And so, you know, Eden's always looking for ideas. How do we shine brighter to help you shine brighter? And so if you've got ideas to share with us as to how we can help with that, we would love to hear it too. So there we go. Jack beat Meredith to it. I love it. All right. So we have about 10 more minutes left, and Jill wants a couple minutes at the end. Now, Vic, Evie, you brought up a really big topic that I kind of touched on earlier, but I think you're getting some feedback on that, and it may be not something we can do a really deep dive on today, but maybe it's a topic we want to bring up next week. Do you want to say anything about what you wrote?
Yeah, so what I wrote in the box is I had a phone call from an administrator who I used to be her consultant, I guess she thinks I'm still her consultant, even though I'm retired, but it was kind of awesome. Anyway, she lost one of her nurses to COVID, and he probably got it in the community. And her company, she doesn't work for Vivage anymore, but her company wouldn't let her share it with the residents. And, you know, this is unconscionable when it's a community member. But it led to a whole discussion around grief and loss. And of course, this is traumatic. And we have to understand how trauma affects us. In the midst of trauma, we have ways of shutting out or getting very anxious. All of us deal with trauma in a different way. But after the fact, trauma manages to emerge often for the rest of our life. And so I suggested that she start holding learning circles and using physical distancing measures, do it outside. She's in Colorado, the weather is good. And on a regular basis, talk about grief, trauma, loss, and all of this. If we don't support our staff, we're supporting in many ways, but often we're forgetting the emotional component of this. So, you know, it'd be interesting to hear how, maybe not today, but next time, other ways that you are helping staff and yourselves, not just, I mean, we all need to deal with this.
Very nice, thank you. And I think, Carmen, you had something you wanted, did you want to add to that? I'm looking for Carmen. There.
While we're waiting, I just wanted to add to what you're saying, Evie, is that there's also going to be a lot of PTSD that's going to happen. And that's going to have to be a part, you know, the grief, loss, PTSD, that whole piece together. And to Bill's point, we need to really be thinking hard about how we're going to respond and come forth as a movement about all of this. We need to really be thinking carefully about that. We've been talking about that here. You know, this is a time for us to really elevate the whole importance of this field and really bring the movement forward. It's the time. So it's really important.
Nice, nice. Carmen, are you still on? Oh, okay. She said not right now, so she's probably.
Hey, Denise, if I could just jump in there, and I'll have to find the article, but there was a really great article that was talking about during this time we shouldn't be seeking to really find happiness so much as meaning. And they referenced some research that found that, you know, when people, well, it was about resilience, and it was also about when people look for meaning during really awful times, they're less likely to experience that PTSD kind of thing. So, you know, it's an interesting thing. And I think it's reflected in some of the things that people shared today. Is it's not, you know, it's like Gail, you know, talking about the stained glass windows. It's finding meaning in this time. It's not just about let's try to entertain people and be happy and ourselves, but just how important that is to healing.
Mm-hmm. Very nice. Very nice. All right. Anybody else? Anything you want to add?
Yeah, this is Mary Miller from Human Good, and I just wanted to say thank you to everybody, because when I started joining these conversations, the next week I started the same thing with our own life enrichment team. So every week I take from this meeting and then I do it in our meeting in the next week, just as a way to practice and pass it along. And it was so exciting this morning because our meetings are at 8:30 same day. And this morning was the first morning where it was like 90% of the conversation was everyone else talking and not me or my partner Christine talking. And they were just collaborating and they were excited. The energy was up. And just 4 weeks ago, this team almost didn't even have a directory of who else was doing the work they were doing in the other communities, because we have 21 communities. And so they were just like learning each other's names. And now they want to segment into levels of living so that the memory support people can work directly with memory support. And then they want to branch over to the affordable housing team to get ideas from them. So it's really just exploding. And I'm so excited because I know this team is going to be a force to be reckoned with. As soon as they realize their power and that they have the right to ask for tablets and, you know, in-home TV and ways to connect with people virtually, and they take on the task of learning the toolkit of virtual. I just think it's going to be really empowering for them and impactful for all of the people that they engage in what they do. So super excited about it. But I want to thank this group because you are the ones that are inspiring me every week to then roll it over to our team the next week.
Yeah, this is a great group. So high fives are coming in the chat box for you.
Yeah, I love what you're doing there at Human Good, Mary, and I think that's really wonderful. And it really plays into this earlier conversation I had today, because they had done a survey of 700 executive directors and the like, and 70% of the respondents said that they had experienced what they called bullying behavior in their career. And as we discussed that this morning, what they talked about was people who, instead of working directly, had used sort of passive aggressive suppression of talented people who they perceived as talented, sort of rivalries, replacing teamwork. And what I sense that you're doing there at Human Good is unleashing the team and letting people really shine forth. What a wonderful thing to be doing. And I hope you can bring your residents in and to engage in that as well.
Yeah, that was one of the questions I put into the chat from what you were saying earlier, Jack, was, okay, what are the easy programs that I could start that just make it easy for residents to help each other, like the Pen Friends. I love that idea, but you know, I'd love to bring like 3 or 4 to our residents because they interact a lot with each other, but it's more like on like resident council stuff. It seems more like it's not so much the heart stuff and more the planning stuff. So.
Hey, Mary, just an idea. Oh, Jack, go ahead.
Well, I was just going to say that the resident council typically are not your true leaders. You know, we know that in the corporate world, that in the corporate world there's the formal organization, then there's the informal organization, and in dysfunctional organizations, the informal organization is often stronger than the formal organization. So, you know, so you want to be thinking that through in a larger sense. But I just wanted to share, we started here as part of our response to COVID. By we, I mean the residents, because the staff didn't care for this. We were not really supported, but we started a daily Zoom gathering. We called our daily Zoom gathering. Unfortunately, the day we named it the daily Zoom gathering, the governor of the state of California said nobody should have gatherings anymore. But, but we thought it was okay because it's our daily Zoom gathering, and we use it. We do it 7 days a week because residents don't take the weekend off, and it's mainly to allow people to become technologically empowered now that they want to. So we have a roving group of people who come in every day. But what we found is that some of the people who come in and master the technology are using it now with their families, and it's really spread technology among the resident group. And I think one of the outcomes that's going to be for senior living from this COVID-19 is an explosion of the use of this kind of connectivity among residents, and an advance of telemedicine where they're going to be using this to interact, so we don't have to move them. What we have residents who go to 10 medical visits a month, you know, and we have to move them to these doctors because heaven forbid a doctor should ever have to leave his office. So I think the consequences of this are tremendous, and I love what you're doing, Mary, and keep doing it. Human Good is on the right track.
Thank you. My primary tool is to play thief and doctor. So I'm stealing from you, and then I'm applying it to doctor things at Human Good.
And hey, Mary, I would just add in there is, you know, the folks that live in your communities know more about what they can do than we do as staff members. So I would just encourage, you know, starting a virtual discussion, whatever it is what does this community need right now? What do we think our neighbors need? What do we need ourselves? And what passions, talents, what do people want to bring forth into that community to make it a better place? And I think you'll get even more powerful, sustainable things out of that. It's like Jack said, you know, that he came up with, he and whoever else he was working with came up with this Zoom meeting. So I would just, and I always encourage communities to do that, is we don't have the answers. And so all people need, especially, and I know Human Good isn't like this, but you know, a lot of places we've pretty much told people, you don't have a lot to offer, but the moment you say, what can you bring forward to make this a better place, a better community, that's where the cool stuff comes from.
Yeah.
And I know I'm preaching to the choir with Human Good on that one. And Denise, can I jump in? Can I talk really quickly about so the other thing that we're doing, if you haven't caught us yet, in addition to these Friday calls and we're doing a weekly happy hour, if anybody wants to join that, informal conversation with Pioneer Network every Wednesday, is we're doing Monday Facebook Live shows. And this is our way of bringing free, inspirational ideas, experts out to people. You can join us live, and so I'm going to put that in the comment box. Just go to the Eden Alternative Facebook page. It's every Monday at 3:30 Eastern time. We have a recording last week, or this past Monday, we talked with Dr. Thomas and Dr. Power about how do you balance infection control with well-being. This coming Monday, we're talking about ageism, and we've got a really great panel. We brought in Leading Age on that, as well as Pioneer Network and Virginia Commonwealth University. The week after, April 20th, if you don't know who Emi Kyoto is, Emi founded Ibasho, and Ibasho came about after the tsunami in Japan. And what Emi and Ibasho did, and these elders did, is it reframed elders to their rightful role in disaster recovery. So, and we are in a disaster right now. And so Emi and I are going to be chatting about what does that look like when you reframe things as older people being the victims in this, to what elders can bring to our society and our communities in terms of recovery. The week after, I already mentioned, is Tony Cachito from Ecligo. We're going to be talking about how can we do recruiting in a different way right now? What are the opportunities we can take advantage of? And then on May 4th, we are, Jack hasn't committed to this yet, but Jack York from It's Never Too Late will be talking about technology and how do you engage people using technology. So lots of great things. And if you join us live, you can put in comments and we engage you on the discussion. And then we also have the recordings available through Facebook and on YouTube. So lots of good stuff coming up.
All right. So again, you all have been so incredibly awesome. You are the wise ones in the room. And thank you so much for joining us today, for being a part of this amazing discussion. And it sounds like your topic for next week is how are you challenging the status quo and what will be different when this is all over? And what can we commit to as a group? So looking forward to that discussion next week. Dr. Thomas, thank you for the suggestion on the topic. And you guys just go, be safe, be healthy, take care of one another as you take care of the elders. And thank you so much for all you are doing every day. Thank you. Thank you. You're welcome to unmute and say goodbye.